Africa Prime, brought to you by Jamison Select Reserve.
Welcome back to Africa Prime. We now continue our conversation with Dr. Douala-Mouteng, CEO of the Pan-African Business Coalition on HIV, AIDS and Health. And before we went to the break, you're talking about successes outside of South Africa in places like Nigeria, Kenya and Zambia. But all this work needs money. You've talked about support from Standard Bank, but how else do you raise the financing necessary to do this work?
We are promoting our work, and we're looking for other partners who can come on board, and we are inviting the donors and bilateral corporations and multilateral corporations to come on board and even to be part of our board of director, because we believe that it's a big work. For instance, in 2010, we implemented the BCAs in Zimbabwe and Swaziland, and in 1 year we were able to train 1,800 owners of small businesses, and the testimony we had, the feedback it was very welcome. People felt the need of being trained, of receive such a training. So we really need people to come on board. And also regarding the as I said, the workplace, we have countries like Angola where we don't have a national business coalition. We need to create them. We have to improve and expand what we're doing in more countries.
One of the aspects of this work is sometimes you're trying to deal with people living with HIV, AIDS, but there are issues around food security all across the continent where people don't even have enough food. Is it something you're also part of your work?
Yes, we think of targeting the SMMEs, the small and minor size enterprises in the food security sector.
Yes.
Because of the challenge you just mentioned. And those people also need to be educated regarding HIV. They also need to improve their business, particularly in the informal economy and the small and minor size enterprises. We are also interested in linking up what the work the private sector is doing with the MDGs, because in 2015, this is a date where an assessment of the Millennium Development Goals will be done, and it's important for the private sector to get more and more involved, to link up with that. And we know that the fight against HIV, AIDS, tuberculosis and malaria can be linked to the MDGs. And as an illustration, I would like to say that if we improve PMTCT in the workplace, we will improve the life, we will reduce child mortality, this is MDG 4, and we will improve the life of women. This is MDG 5, for instance. And we think of organizing this year. We're looking for partners to organize a forum to get the private sector more involved in the MDGs.
Are there any particular successes that you can talk about? Because sometimes people are afraid and donors fear that all the financing goes into organizing press conferences, workshops and seminars, and not into actual work on the ground.
I would like to say two things. The first thing is that in Nigeria, after we have started with our AIDS program, an organization we're not targeting came to us. We want to finance it. Can we use your tool, because this is very useful for us?
Yes.
So with this, we believe it's a success. Also, we have been selected by the MSH Management Science for Health and we will have our capacity built during 6 to 9 months, so we will be able to handle the funds from the USAID and the FID, CDC, etc.
Why is it important for the private sector to be involved actively in fighting and putting in place policies to deal with HIV, AIDS? Because sometimes they may say, I'm a big company, but I don't have anybody in my staff who's affected or infected by HIV, AIDS.
It's very important for many reasons. The first one being that there is an economic crisis in the Western countries. And in Africa, the role of the private sector is thus increasing to supplement what the governments are doing. And the private sector comes also with the mindset of private sector. Mindset, that means efficiency and new ways of seeing and dealing with issues. So this is very important for the private sector to be linked, to partner closely with the government.
Do you see a lot of them starting to put in place community social responsibility activities around HIV/AIDS, and do you want that to go on?
Oh yes, a lot of companies, multinationals particularly, as I said, are doing that, and we would like to say that again. We're grateful to Standard Bank for the support we received from Standard Bank, and I would like to say also that Standard Bank is providing us with our COO, who is Danish Apuvu. This is because you mentioned the issue of governance.
Yes.
So we are very much guided, I can say. So the funds are saved and they go directly to the community. We have a little secretariat, so the money is not spent in administration. The money goes directly. We work through our National Business Coalition and we reach the community, particularly the associations.
What is the role of governments in dealing with the pandemic? Because there are places across the continent where they cannot access antiretroviral drugs. The situation and the environment in which people living with HIV/AIDS live is pitiable.
Yes, the role of a government is huge because the government gives a strategic direction, determines the priorities and the plans, and all the stakeholders have now to comply or to come and look for their niche in the plans the government are developing. And particularly regarding HIV and AIDS, the government provides, in most of the cases, with treatment. In 2001, the countries of Africa, the head of state pledged to allocate 15% of their annual budget to the financement of health. And we know that it's very difficult for them. Only about 5 countries are doing that. In South Africa, we are lucky because the government is providing the ARVs free of charge.
Right.
In other countries, the government is providing the ARVs, but the government receives the grants from the Global Fund. So it's not easy. So we know that many companies are providing ARVs. This is very good.
Do you see work being done to bring down the infection rates? Because if more and more people are getting infected, then the crisis becomes bigger.
We can say that not more and more people are getting infected. The incidence is decreasing.
Right.
Yes, but there is still a long way to go because in sub-Saharan Africa, 1.8 million people are getting infected every year. And we have the evidence that prevention works. It's important to continue making an emphasis on prevention. And because the number of people who are living with HIV is increasing, but it's increasing because people are living longer, people on treatment. And this is good for enterprises because we keep the experience, the workers, expertise, etc.
Yes.
So, but that we still have to fight, and we have now, the challenge is to find innovative, cost-effective approaches and sustainable approaches. And the approaches that can be scaled up in the countries. And this is the challenge. That's why prevention is really the priority. And in Zambia, according to the UNAIDS report, they have noticed a decrease in the incidence of the people infected with HIV. And it was due to, first, of the delay of the beginning of a sexual life among the youth.
Right.
It was due to the use, an increased use of condom with casual partners, and even a decrease in the number of partners. This is very important.
So it is about, in a sense, a lifestyle change, and throwing money at the problem will not necessarily solve it.
It's good to use the money the best way.
Yes.
To make the money work the best way.
What is the future for the Pan-African Business Coalition? What is your vision? Where are you taking it?
What we want, we really want to, as I said, we want all the countries to have a national business coalition, but strong and sustainable national business coalition, because we have to continue fighting against HIV. Before a vaccination is provided against this disease, we have to fight. But I want to add something.
Right.
There are other health threats coming in. The non-communicable diseases. That's why we have broadened our scope from HIV, tuberculosis, and malaria to health issues, because hypertension, cardiovascular diseases, obesity, cancers are becoming very big problem in Africa, and it is forecast that in the future, Africa
Right.
would bear the greatest part of that burden. So it is important for the companies to start getting involved in the prevention of those diseases because we are all preventable.
Would we ever get to a point where AIDS, HIV/AIDS is no longer a crisis, and indeed all these other communicable, non-communicable diseases that you're talking about?
Regarding AIDS, there is a dream.
Yes.
Of no new infection, no discrimination, no HIV-related death. And now it is virtually possible. And regarding non-communicable disease, I believe that the lessons we have learned from the fight against HIV will be useful for the future.
And on that optimistic note, it's where to end it. Many thanks to you for coming on. We appreciate it. That was Dr. Douala-Mouteng, CEO of the Pan-African Business Coalition on HIV, AIDS and Health, discussing her vision to mitigate the impact of HIV/AIDS on business in Africa.